Yeah. Okay, so today it's just about hand-arm vibration and solving it in the scientific way. And the key message is to prevent HAVS and to prevent that HAVS through data and taking action on the data. And I think that's the key point, really. And I'll start with this. If there's one thing that you can take from this presentation, and if there's only one thing that you doze off after this, I'm happy for you to just take off the presentation with this message. So the only way to effectively manage the risk of developing HAVS in the workforce is to actually eliminate the risk. And when that's not possible, significantly reduce the exposure to vibration. It doesn't matter how much data you gather, how many products you use, or if you don't use any products, if you don't do anything about the risk, you're not actually reducing the risk, and the HSE will still not be very happy with your procedures. So I'll have a few slides that I've prepared just on the topic of HAVS, and then I'll move on to the hierarchy of HAVS control as well. So we all know what HAVS is, I hope, but just because obviously this will be shared, I want to go through it in more detail. So hand-arm vibration syndrome is a condition that is developed by people who work with power tools or vibrating machinery. The symptoms always start with neurological symptoms. So you get tingling and numbness in the fingertips. And then it progresses to musculoskeletal symptoms, which essentially is damage to the muscles and the median nerve on the palm of the hand. That leads to carpal tunnel syndrome. And then in the advanced stages, if you keep working with vibration and routinely go over the limits, you would eventually go into vascular symptoms. And those are permanent. So once you have them, they never go away. So like I said, HAVS is permanent, but the good news is that it's preventable. So if you have the right control measures in place, you can prevent this, and it will never be a problem for the workforce, and it will never be a financial problem for the business. There are 2 million people just in the UK, and there are probably more than 2 million people, but this is the latest statistics from the HSE in 2020, 2021. So more than 2 million people now exposed in the UK. More than just over 300,000 already have claims and have symptoms that are permanent and they will never go away. 89% are men, 11% are women. The worry is that we've seen cases increase, not decrease, which is very interesting because obviously HAVS takes a long time. And even though technology has improved and tools and tool manufacturers are doing a great job in designing better tools, lower vibration tools, because HAVS takes a long time to develop and the symptoms take a long time to take shape, we're now seeing cases come up from people that were exposed 10, 15 years ago and have kept working with vibration for this period as well. More than 250 tools and work processes expose people to hand-arm vibration syndrome, and around 40%, 35-40% are construction tools and construction processes. So construction is the biggest area where people are exposed to vibration. And we've, from our experience in working with over 230 sites in the UK, US, and Canada, we found that those factors are the main 4 factors that influence exposure and get people to have the symptom. So duration of exposure, I think that's one of probably the top one. People just spend too much time during their work shift working with power tools. The second one is hand-arm resonance. So that means the operator hand-arm system that's composed of skin, muscles, bones, and vascular structures. So all of that biological mechanism as a coupled system resonates. The natural frequency of that system coincides with the frequency that the tool is exhibiting. So when that two coincide, you get resonance, and that's when blood is being pushed off your fingers, and you essentially end up with hand-arm vibration syndrome if you continue working that way. Now, grip strength is also a big factor. So we've seen many cases, and this is a very regular control measure that we advise and see with our clients, that if you just gripped a little bit lighter than what you're doing, you would actually reduce the exposure by more than half. And then tool maintenance, of course, picking the right tools, having the right consumables for the tool, making sure the tool is calibrated, and it's, you know, you're not working with the oldest tool in the toolkit. Construction specifically, those are the activities that impact workers' hands, and those are the tools that do the damage. So you know, in construction, we do have a lot of data gathered from construction companies that we work with, and we're going to be part of HS2 as well soon. So we're going to get some really nice case studies done on that project. And then control measures. I think this is, again, one of the key slides in the whole presentation. And I want to make this point very clear for everyone that's watching, that any technology that you use to manage the risk of HAVS needs to have this central focus of arriving at control measures. We don't advocate for continuous monitoring or measurements. As soon as you have enough data, the platform and the system will alert you that you've reached a level where you can now look at the data and understand what the root cause is and implement control measures. And control measures always start with awareness. So even before any technology or any data, you need to make the workforce aware of the problem. The managers and the directors, so all levels of the organizations, have to be aware of the risk, and have the, you know, documentation and training for people to understand what HAVS is and how it's being how it affects the workforce. Tool selection, job rotations, those are control measures. I'm going to go through a few specific examples in the hierarchy of controls, but those are essentially let's say the low-hanging fruit. You know, that data always reveals quite quickly. You know, are you actually using the right tools? Is the consumable maintained right, or is it worn out? And then job rotations, is someone more exposed than another person, and by doing the same job, can we rotate people more effectively? Can we build best practice guides for them to work in a more efficient way? And then there are 3 things that you can do. You know, blood circulation, keep your hands warm and dry, stretch your hands during breaks, massage your hands to get the blood flowing into your hands. Keep tool handles away from being cold, so don't touch or try not to touch tool handles when they're really cold. And then avoid gripping really strongly on them as well. And then once you've kind of made your journey through the control measures, especially if you have good data in place, it'll be quite easy to go on this kind of continuous improvement loop where you're always improving and reaching lower and lower exposure values on a daily basis. And then the next 2 slides cover something that's very close to me, which is the difference between measurement and monitoring. So time tracking or monitoring is the traditional way of doing things. So you'll be, you know, using a paper base or an Excel type way of managing HAVS, where you either ask the operators how long have you used the tool, or you time track them somehow with a watch or a timer or some sort of time-based mechanism. And then you do either manual calculations based on the HSC calculator and the A8 formulas, or you would let sort of an automated calculation being done on standard values of the manufacturer's datasheet, or in the best case scenario, values that an occupational hygienist has come on site to measure. But again, when did they measure that? Who they measured it with? What was the grip force? What was the posture? All of that is neglected in the sense of monitoring or time tracking methods. And then the vibration measurement is you're actually putting the sensors in the right place, compliant to ISO 5349. You're using technology and instrumentation that complies with the relevant standards and the calibration procedures of ISO 8041. You're measuring that not just for a few minutes to record the vibration magnitude, but you're measuring a whole shift, or even better, a week worth of data from a specific individual, especially in construction, where the processes are so variable that you work with multiple tools in a day, and you one day might not be the same as the previous day. So if you measure for, we found that 5, maybe 10 days max of data per individual or per process would be enough to understand what the root cause is and have enough data to make some real decisions that actually impact exposure on a daily basis. And then this is some real data from a construction environment, comparing time tracking versus measurement. So you can see on the left-hand side, that was a paper-based system, essentially estimating how long an operator has been using a tool, and then using the tool manufacturer's datasheet or the a database, one of those two, to estimate how many points they've accumulated in their shift. But the operator was also wearing the HAVS Sentry glove, and we've recorded that a really big difference. For example, with the disc cutter and heavy breaker, there were 351 points difference. So the time tracking method, the monitoring method, was showing that you're actually fine, you're safe, where in reality you were actually getting to over the limit values, or close to the limit value, sorry. And then on the right hand side, we have the wrist mounted solution, essentially wearing in parallel with the glove solution, with our HAVS Sentry solution. And you can see, even with the 20 to 35 minute exposure, the difference is still very significant. Now, if this was a whole shift of measurements, that would be even more. So the conclusion on this sort of investigation was that vibration exposure measurements are up to 23 times higher than those that are self-reported. So the paper-based system. And then vibration exposure measurements are up to 9 times higher than those using time tracking, so with the wrist-mounted solution. So tool timers or watches provide trigger times, but no vibration measurement data. They rely on tool manufacturer's datasheet or some sort of database of vibration values that are not specific to that individual or not specific to that process. And then tool timers have errors because they require operators to keep tagging or untagging from the tool, whereas a measurement with HAVS Sentry would just be wear the glove, do your work, and come back and we'll see what what exposure is. And that is groundbreaking, because now it's not tool dependent anymore, right? You can just do your work and it will pick up everything. It's not just working with power tools. It will pick up shoveling and hammering and any manual labor, because obviously shoveling and hammering are impact to the median nerve, right? That you do have impact vibration. It's not prolonged exposure like it would be with a tool that vibrates to a higher frequency, but it's very low frequency, which is called impact vibration, essentially. And we can pick up those incidents, and we report back on them as well. So that concludes that part of the presentation. Now I'll go into the hierarchy of HAVS controls. And this is where I hope I can provide a little bit more value to from the experience that we've had. So I'm sure you're familiar with the hierarchy of HAVS controls. And we found that it's quite easy for us to use wearable technology that's compliant to the relevant standards into the HAVS guidance to actually guide people into making decisions to try to reduce exposure as much as possible. So the first thing would be to try to eliminate the risk, and that means instead of using a traditional breaker or jackhammer, if you can get them something like this, and there won't be a need for them to touch the vibration equipment. Now, of course, that is not obviously affordable for every business out there, but another practical measure would be to just use prefabricated components. So get them before and get them delivered as you want them to be, rather than making them or breaking them on site. Tool substitution. This would be using lower vibrating power tools, so usually electric power tools. There is a warning here that longer trigger times remove the benefits of lower vibration magnitudes, and that means it does vibrate less, but you have to work maybe 2 times more to complete the job. So it kind of neglects the whole point of tool substitution in that way, because you're increasing the duration of exposure, which is the main factor, like I said before, in exposure. Another practical measure for substitution would be to, and this is specific for construction, replace percussion tools with hydraulic ones or lower vibration alternatives. And like I said, be careful with how long does it take for the job to be finished when you do this kind of exercise. But data can help you in this task as well. So we have clients in the construction and the landscaping industry that use HAVS entry to rank tools, so they know which tool is the most dangerous, and they know by the same token which tool is the most effective. And then we have engineering controls. That's the next lower down control measure that you could take. So implement vibration dampening tool mounts or handles. So these are not anti-vibration gloves. These are dampening tool mounts or handles. So you would equip tools with those type of things which you can actually retrofit on the system, and that actually has a very positive impact on exposure. Systems of work. So this would be traditional, job rotation schedules. Of course, with data, you know exactly when that should happen, because the HAVS entry system, for example, alerts you in real time when you've reached the exposure action value and the limit value, so you know when to go to the manager and say, oh, I need a job rotation. And also things like grip force and posture and operator behavior, which is the next part and the last part that of the control measures hierarchy. So with accurate data on all the relevant parameters, you can build, and we have built very effective best practice guides for operators to be trained on and understand who's doing the job in the most efficient way. Can we learn something from that person? And we've seen, actually, it's really interesting to see, it comes, it becomes a sort of pride contest. So we're like, oh, I'm learn from me, I'm doing this. And operators start sharing, and construction workers start sharing best practices between themselves, just because now they have data to back it up and say, look, I'm doing the best job. I know how to work and not expose myself. So it's really, really cool to see when that happens on site, and I take great pride in doing that type of work. And then the last part of the hierarchy of controls is PPE, but unfortunately for gloves there is no PPE. So sorry, for HAVS. There was a great study published by some really great scientists. Sue Hewitt, one of them, the HSC vibration specialist, and clearly proven that anti-vibration gloves can actually impact negatively the exposure and the absorption, let's say, of vibration, and that's mainly because anti-vibration gloves reduce the frequency of vibration. They also reduce the amplitude, that's the benefit of using it. But they also reduce the frequency of vibration. And if you look at the weighting factor, which is the red line there, the weighting factor is a lot higher at lower frequencies. So the anti-vibration gloves actually reduces that into the danger zone of the frequency, and that is dangerous in the lower part of the weighting factor curve, because that's where when we were talking before about resonance, that's where the human hand-arm system has the most resonance points, is between somewhere around 10-15 hertz to about 120 hertz. That the normal average human hand has about 90 to 96 resonance points at that in that zone. So if you are bringing the vibration of the tool exactly in that zone, you're a lot more likely to actually get your hand-arm system into resonance, and that's what generates the symptoms of HAVS. So that's done again with that part of the presentation. Now I'll jump into something that I've done research on specifically for this construction network webinar. I've looked at other webinars that you've done in the past, and it's quite clear that this group likes to bring in mental health and understand how construction workers are being affected. So I've done some research, and I found some really good papers which I'll share with Jenny, and she can then share with the audience. But essentially, over a quarter of workers with HAVS symptoms report feeling depressed. They experience, 28% of them experience clinically significant anxiety, and many of them feel a loss of identity, isolation, and frustration. And these metrics are specific for people with HAVS. Like I said, I'm going to share this article, brilliant article, and they've actually ranked symptoms of depression and mental health based on the workers' feedback. So the top one was always related to the fear of not being able to provide for the family. Because you get HAVS, because you're impaired and you can't do your job anymore, you are actually at risk of losing your job, or being not being promoted anymore, not advancing in your career. So and that was really interesting to see that everybody or virtually everyone, that is the top one priority for everyone, is providing for their families. And then everything else was physical symptoms. So, I can't button my shirts, I can't hold a cup of tea, I can't hold someone's hand and things like that, which is, very distressing. And I understand, and it's quite understandable that would cause anxiety and frustration. But it was really interesting to see that the top number one reason is I'm not able to provide for my family anymore. So let's try to do our best and protect those people, and use the latest technology to do that, because nowadays sensors have become so small that you can actually fit them on the palm of your hand and be compliant to the regulations, and do the job in a lot more accurate way. So I'll jump into my journey now. Why am I doing all this? Or how did this all start, and where is it going? So for me, it all started while I was working at a big aerospace manufacturer in the UK. I was just really an engineer. I had nothing to do with health and safety at work. I was a mechanical engineer working on big fan blades and compressor components. I was doing a factory tour. I forgot exactly why, but I was on a factory tour, and I was escorted by the health and safety manager. And some of the worker, one specific individual came to the health and safety manager and said, "Oh, I have some numbness and tingling. I think I would like to report this." And he said, "Yeah, sure, report this and do a job rotation." And that kind of struck me as a bit odd because it was very reactive, right? So waiting for symptoms and then taking action. It was something that it didn't sit right with me. So I did some research. I then proposed a way of measuring vibration for my employer, and people said, "Great, do it. Try to make this thing work." So I started prototyping. You can see me here in my bedroom prototyping my own devices. I was quite young at the time, and eventually they worked. So I presented again and said, "Can we do some measurements? I think I can make this actually work." And then everybody was saying, "Oh, this is intellectual property. This is a patent. This is you can license it. You can start your own business." So I went back to Cambridge University, where I did my mechanical engineering degree, and I told them, "Look, I have this idea. I think there is merit for it because we did have others come in to showcase their solutions, and there was really nothing out there that could do even half of what we were trying to do." And Cambridge University helped me patent this and start a business. And then in 2018, we officially incorporated a business, and we started doing product development, raising investment, market trials. It was a really, really interesting part of my journey, actually, and I'm still going through it right now. You can see me here on this picture holding a vibrating piece of equipment, a shaker that I personally wanted to do tests with, and I did so many tests. I actually started feeling numbness and tingling myself. So I actually had to bring in more people and help me and spread the exposure in that way. But I really wanted to make sure that we build a compliant product. So as soon as we had something that we felt confident this works, well, first of all, that's when the pandemic hit, so it delayed everything for us. But then as soon as that calmed down, then we went to the HSC and we said, "Listen, we know you have this statement out there, which was published in 2017, saying there is currently no glove that can measure vibration according to the standards. I think we've just built one, and we would like you to have it and benchmark it, test it, do whatever you want with it, find limitations." And it was really interesting to see vibration specialists at Buxton Lab saying, "Oh, you're actually the first one that volunteered their technology to do this." So I thought it was normal practice, to be fair, that you invent something or get something done and then you put it to the specialist to validate it. So that's what we did. And then in December 2023, the statement was taken down. So there is no more statement that says currently there's no glove that measures vibration. And new guidance was published to differentiate between monitoring and measurement. And you can find that online. I'll share a link with Jenny, and she can forward it to you as well after this. And then, of course, now, like I said, we want to be part of the big projects and scale up and reach international markets. We do have clients in the US and Canada. We work with 3 businesses there, and a local authority, or in the UK we'll call them councils. In the US they just call them cities, city authorities. So we do have some interesting projects going on in the US and Canada. and we're expanding very, very rapidly right now. So that's essentially, about 10 years of work in a few minutes of describing it. And we're not stopping until we solve this problem. So I've been everywhere to trying to raise awareness, even being asked to come to Westminster to do a speech for MPs so that we can put this on the national agenda. So I'm really trying to get HAVS to be recognized as the risk that it actually is, because it does affect people. It does destroy lives and ruin people's careers. And we want our colleagues to be able to retire without having to worry about their hands. So that was the presentation. Now I do have a quick announcement to make, which is related to new technology, and this is in the form of artificial intelligence. So we're launching, and we have launched already for several months quietly with our existing clients, our own AI agent that can already analyze data and prompt managers with insights, compare between operators, teams, and tools, understand what tools and processes are the problem, build the accurate database for your work processes, and generate automated exposure reports, assessment, and then also notify when people reach the exposure action value or limit value, so you can take immediate action. And then coming soon, we have some really, really exciting ones that, I do say this all the time, that I think we're probably about at least 7 years ahead of everything else out there. And with this coming soon functionality, we're probably going to be 10, 15 years ahead of what's going on. So, do jump on the early adopter train and take advantage of the latest technology and be seen as the innovator in industry. Thank you very much for listening.